As we all look forward to nicer days ahead, do not forget, please, your sunblock. Joining us this morning with skin cancer prevention tips is Dr. Judith Hellman, Manhattan dermatologist and associate professor of dermatology at Mount Sinai School of Medicine. Thanks for coming back to talk to us about this.
Nice to see you, Michelle.
One of the things that you talk about is the fact that sunscreen during the winter isn't necessarily the same stuff that we should be using now. Is that right?
Indeed, all the products that we use in the winter should be a little bit different because they should be a little heavier to protect from the wind and from the indoor heating. In the summer, when there's a lot of humidity, we can use things that have lighter texture, such as sprays, gels, and serums. And they're much better for the skin. They don't clog up the pores, they don't aggravate acne, and they're generally better to tolerate, and they don't drip into your face.
Right. Let's talk. So in the winter, you want more of a moisturizing type deal that just sits there.
Exactly.
But you do not want to feel like that in the summertime.
No, you don't.
So switch it up. If you, and a lot of people will say, well, I don't want to wear sunscreen because it's just sitting there. Don't wear that one. You got to buy something different.
Absolutely.
Right.
And people should really seek out help because some people use the same product all year round. And it's not appropriate, and it doesn't do well for them.
Do you want to show us some of the stuff here now?
Sure, I would love to.
What's here?
These are acne medications, Differin and Tezoret, that come in a cream for the winter. They come in a gel form for the summer. I switch my patients often. We have moisturizing creams for basic moisturizing for the winter. I prefer serums, which are much lighter for the summer.
Is that men and women? Doesn't matter?
Men and women, especially men. Men don't like creams anyway.
Right, yeah. So it's much lighter,
light
right?
stuff.
Okay.
We have glycolic acid creams for the winter, come in a wonderful lotion for the summer. And of course, foundation, which a lot of women use, much better in the winter in liquid form, but in the summer all you need is a little bit of powder, mineral powder, doesn't clog up the pores.
And so many companies make this stuff now.
A lot of companies make this stuff very easy to find. Any drugstore or department store would have it. And
we make it a little bit of a crazy family affair when we spray on the sunscreen. We did all last weekend. We had the 70 all over before we put on our bathing suits everywhere. My 2-year-old was laughing, running around because it's cold.
Perfect, and it's the best thing is to get them used to this when they're really young. My son is asking for his sunscreen when I forget to apply it. And it's very important to remember that if you sweat or if you go swimming, the sunscreen wears off. So you have to reapply.
UVA, UVB, this is definitely covers everything. This is, I think, 70?
Yeah, this is not only 70. This has something called Helioplex. It's a Neutrogena product. And that means that it's really broad spectrum and a high SPF. And will give you very good protection for sun.
And these sprays are great because they spray upside down. And they're great when you're out in the heat because they're kind of cooling. They're nice as well. Let's talk about checking ourselves for moles that might be sort of suspect. What I had on my face when I was 30, when I had skin cancer, it wasn't even a mole. It wasn't much. But if you have an aberration, definitely get it checked out.
Absolutely. And as you know, since skin cancers now come at early ages, you got it at 30. And so it's very important once or twice a year to have somebody check. However, there are certain things that you can do yourself at home and watch out for. And these are what we call the ABCDS of skin cancer. Right.
Let's pop up that list again. Asymmetry is one of them?
Yes. Well, a normal mole. Let me start off with the fact that a normal mole should be perfectly round and symmetrical, no matter where you cut through it. It should have nice, smooth borders, and it should have uniform color, no matter whether it's dark or light. So what you see here in A for asymmetry is no matter where you cut this mole, it's going to be different on both sides. The borders for B should be smooth, not sort of scalloped or jagged, and there should be no pigment coming out of the border. C stands for the color. Any mole that has more than one color, dark brown, light brown, especially the white color is very worrisome, and also red, should be assigned to be, to be careful, to be alert that this could be a funny mole. And D for diameter means that the mole should not be bigger than 6 millimeters, the size of a pencil eraser.
Any change, get it checked out.
And some moles have some of these characteristics. Some moles have all of these characteristics. But the most important thing is to make sure that an ounce of prevention is worth a ton of cure. And if you go and have somebody look at these moles, they can tell you you're not maybe harboring a melanoma, which can be life-threatening. And if it's treated early, it's perfectly curable.
Right. Watch out for yourselves and watch out for the kids. Good to see you.
Good to see you.
Stay in the shade.
Absolutely.
Happy summer. We put all of these tips and a link to Dr. Hellman's website on our website at 7online.com. Click on the See It on TV link on the upper right-hand side of the page. You'll see weekend morning interviews and tips. That's where you'll find everything. We're coming right back with